For patients with myeloproliferative neoplasms, or MPNs, visits with your healthcare team are an important part of managing your condition, but they can often be stressful. That's because it's not always easy to remember all of the things you wanted to cover, such as concerns about your symptoms, specific questions about your condition, or anything else you may want to discuss. The good news is that there are a few things that you can do to help get the most out of your visit, whether it's in the office or via telehealth.
Preparing for an office visit with a patient with an MPN includes review of the patient's information, including any recent labs and other studies. I always want to make sure that we're having an informed conversation about what's going on with their health. When a patient is open about how they've been feeling and willing to share specific details about what they've been experiencing, it makes for more informed discussions about their care.
Telehealth visits may add another level of challenge, especially if you're not used to doing them. So, let's talk about how to be prepared for whatever type of MPN care visit you might be having and see what a good MPN visit looks like.
Having the opportunity to hear how a patient's daily life is affected by their MPN really helps me understand what they're going through and allows us to have more meaningful conversations. These insights can help us work together to ensure that the patient's care management approach is the right one for them.
Tracking symptoms helps you document how your condition may be changing over time, and it means that you don't have to rely on memory alone. There are many ways of tracking symptoms, including using an online resource like the MPN Tracker tool, available at mpnsymptomtracker.com/visit. Questions you might ask include things like, how often will I need to be seen? What should I watch for in between appointments? What tests will I need to get and what will they tell us? How can I deal with fatigue or other symptoms? Now, let's meet patient Tammy and see how an MPN visit might go if she has prepared for the visit, including thinking about what questions she wants to get answered.
How have you been feeling?
Not too bad overall, but I do have some questions about my symptoms. I seem to be more fatigued than before. Also, I have noticed I seem to be eating less. Is that a part of my PV?
Tammy's doing a great job of asking questions, and I'm always glad to answer. But I need to ask questions too. I might ask some questions about the effect of fatigue on her life, and also get some more detail around her appetite. I want to probe some more about both of those things. I might ask Tammy, what were you able to do in the past 3 months or so that you aren't able to do now because of fatigue? I'd also want to ask Tammy more about her eating habits. Are you finding that you're eating less because you feel full early, or just aren't very hungry? I might also ask whether her previous symptoms are better or worse.
It is important to be as specific as possible when telling your care team about how your MPN is affecting your day-to-day life. These details may provide really helpful information, so be sure to give complete and honest answers. And don't be afraid to mention all the symptoms you've been experiencing, even if you don't think they're related to your MPN. The more information you share, the better. It's also important that you're getting the details you need from your healthcare professional. Now, let's get back to the visit and see an example of a conversation in which both Tammy and Dr. Gowan offered detailed responses.
Tammy, you said that your fatigue is worse. I'd like to get a sense of how that's affecting your day-to-day life. What were you able to do in the past 3 months or so that you aren't able to do now because of fatigue?
I was supposed to go to a family birthday party last week but didn't have the energy, and I just went to a birthday party 2 months ago.
Because both Dr. Gowan and Tammy focused on specific details about Tammy's symptom burden, they were able to have an informed discussion about how Tammy's fatigue is affecting her daily life.
Tammy, you said that you seem to be eating less. Are you finding that you're eating less because you feel full early, or just aren't very hungry?
I seem to feel full earlier compared to before. I would usually eat a sandwich for lunch, but now I feel full after only a few bites.
I'm glad you brought these specific details to my attention. I'd like to schedule an in-office visit so I can check the size of your spleen. By having a detailed discussion with Tammy about her eating habits, I've gotten some really important specific information from her. The fact that she feels full earlier may mean that her spleen has become enlarged. Tracking the size of the spleen is important in patients with MPNs because the spleen can become enlarged. I usually try to do the spleen exam in my office, but in some cases, I may send a patient for an imaging study, such as an ultrasound.
If your healthcare professional has trouble measuring your spleen based on physical exam alone, he or she may order an imaging study, like ultrasound, CT scan, or MRI. This might also be an option if your current MPN care appointment is a telehealth visit and you're not physically in the office.
Remember, there are some aspects of your MPN care that may need to be addressed in person. Be sure to discuss your options with your healthcare professional.
Now, let's get back to our office visit. As we just discussed, it's important to be an advocate for your own health. Let's see what it looks like when Tammy does just that.
Well, Dr. Gowan, I've been doing some reading, and I have some questions about my current care plan. I would like to better understand why we are doing what we are doing, and whether there are other things that we can do that might help me.
Sure. Tell me what you've been reading and what you'd like to know more about. Your care team should always want to hear what you have to say, including your questions, concerns, and ideas. Remember, the relationship between you and your care team is a partnership, and you're working together to ensure that you have the care that's right for you. Also know that you always have the option to seek a second opinion or visit a healthcare professional who specializes in MPNs if you haven't done so already. MPNs are rare chronic blood cancers that many healthcare professionals don't see very often. Including an MPN specialist in your care may give you a chance to work with someone who is very familiar with your condition and sees numerous patients who have it. Keep in mind that adding an MPN specialist to your care team doesn't mean you have to stop seeing your other healthcare professionals. In fact, we often work together in partnership to determine the best care management approach for you. Remember, too, that your care team may also include advanced practice providers, APPs, like nurse practitioners and physician assistants, as well as other office staff. Be sure to connect with them in order to make the most of the support you're receiving. For example, if a nurse practitioner sees you before the healthcare professional, make sure to share symptoms and any challenges that you're having on a day-to-day basis living with your MPN.
So, in order to make the most out of your next MPN visit, remember these 4 tips. 1. Be prepared. 2. Don't be afraid to ask questions. 3. Be specific. 4. Be your own advocate.